name is Joni Dietz with the Human Development Center. I'm the program director in the Cloquet office. And thank you all for joining. So like I said, this is our Supporting Families series, and this evening's session is about the essentials of trauma-informed parenting. And I'm excited to introduce to you Taryn, a clinician here at HDC, and Marcia Anick, a practitioner and supervisor here at HDC. I'll let you ladies take it away.
Hi. Thank you for all joining us today. I just wanted to let you know our presentation today is about the essentials of trauma-informed care for parents. And some of the things we have set up to you today is kind of introductory on how the basics, when a clinician and you bring your child in for a DA, or our terminology is comprehensive evaluation. How do they diagnose trauma, and a little bit about what trauma is. So we're going to try to define that trauma and what events kind of lead to that trauma diagnosis. We do have an exercise in here, which is an exercise, actually it's an assessment that people fill out, and it's an ACEs survey, and that stands for Adverse Childhood Experiences. And so that your ACE score, so we're going to have you kind of do a little scenario where you yourself take the ACEs, and as we move on, Taryn is going to share a little bit from the clinician perspective regarding this. And some of the things I'm going to share is kind of from the practitioner form. My providers that do CTSS, and I do it as well. We do skills-based activities. And those skills that we practice in sessions go right from that diagnosis. And so any diagnosis a kiddo has by a clinician, essentially what we do is we set measurable goals and objectives. The therapist sets them, and also the practitioner sets them. And what we like to call that is, when we set those goals, it's always a golden thread is the terminology we use. So that means anything from a diagnosis, it'll go right on through to those measurable goals and also those objectives. And that's what we practice in sessions. And so everything's linked back to a diagnosis. So if they have, a diagnosis of PTSD or trauma, that's where we work from. If you have any questions during this time, feel free to raise your hand or put it in the chat, and Joni will be kind enough to kind of let us know when you have questions, and they'll stop us when that time comes.
Got it.
Also, we're going to have a little bit of a case study. And in that case study, we're just going to kind of present, a case. It's not based on a real client, and kind of how that ties into a diagnosis and certain recommendations we have for kiddos that do experience trauma. And where that comes from. One of the main things I just want to point out really quick is there's trauma from childhood experiences. We're going to clarify that, but also considering what's going on in the world for the past couple of years with the COVID, that is some type of trauma as well, but we're going to kind of bring it down to the finer points of what qualifies for a trauma diagnosis and what does not. So if you're confused at any point, we'd love to hear questions. So thank you.
All right, so we're going to start with ACEs and vulnerability to stress. So like like Marcia said, ACEs are adverse childhood experiences that occur during the ages of 0 to 17. And ACEs, they have lasting negative effects on health, well-being, and just one's opportunity. So just some statistics. If you have a score of 4 or higher, you're 2.4 times more likely to have a stroke, 1 times more likely to have cancer. However, there's 12 more times likely to have a suicide attempt and 7 times more likely to become an alcoholic. So that's why we like to focus on these to kind of help address some of these concerns to so we can reprocess and develop more healthy coping strategies. So adverse childhood experiences comes in many forms. There's physical abuse, mental abuse, neglect, and household dysfunction. And like I mentioned earlier, there is a study that directly correlates ACEs to future health complications. Since then, we've learned more about the psychological effects of ACEs on children, including long-term health complications and recurring exposure. And they can also interrupt the effects by providing safe, stable, nurturing environments, help support social emotion skills and resilience. And that's what we would focus on in therapy. And this is just another slide to show this different kind of ACEs that we have. So like physical, emotional, sexual abuse, and then neglect would be physical and emotional neglect, and household dysfunction would be if a family member had mental illness in the household, a mother was treated violently, there was a divorce, if a relative was incarcerated, or if there was a family member that had a household member that had a substance abuse issue. All right, so this is where we're going to have our little activity. So I will go through all of these, and I just want you to keep track of your ACE score. You don't have to share these with anybody. We're not going to ask you for your ACE score. But I just want to keep track want you to keep track either by your fingers or marking it down. And this is before your 18th birthday. So before your 18th birthday, did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you? So give yourself a point if that, or give your 1 point if that has happened. Did a parent or another adult in the household often or very often push, grab, slap, or throw something at you? Did an adult or a person 5 years or older than you ever touch you or fondle you, or touch you or made you touch their body in a sexual way, or attempt to have oral, anal, or vaginal intercourse with you? Did you often or very often feel that no one in your family loved you or thought you were important or special? Did you often or very often feel that you did not have enough to eat, had to wear dirty clothes, had no one to protect you, or your parents were too drunk or high to take care of you or take you to the doctor if you needed it? Was a biological parent ever lost to you through divorce, abandonment, or other reasons? Was your mother or stepmother often or very often pushed, grabbed, slapped, or had something thrown at her? Or sometimes often or very often kicked, bitten, hit with a fist, or hit with something hard? Or ever repeatedly hit over at least a few minutes or threatened with a gun or knife? Did you live with anyone who was a problem drinker or alcoholic or who used street drugs? Was a household member depressed or mentally ill, or did a household member attempt suicide? And then the last one, did a household member ever go to prison? There is an additional ACE study or an ACE that you can do that adds more of racism, bullying, and community violence. However, at HDC, we just do that standard 10 question one. But again, I'm not asking you to share anything, but just want you to think to yourself. Looking back at your ACE score, how does your ACE score impact your vulnerability, distress, or parenting style? And again, it doesn't have to, depending on if you have a low ACE score or high ACE score. So just gonna give you a couple seconds to think about that. And then how do your child ACEs score set context for the child's experience of stress in over all of 2021? Uh, we can move forward. So what is trauma? So these are just different terms of trauma that other people have come up with. So first one is trauma is an emotional response to a terrible event. Immediately after the event, shock or denial are typical. Longer term reactions include unpredictable emotions, flashbacks, or even physical symptoms like headaches or nausea. Trauma can also be defined as trauma is the experience that causes a person to feel afraid, overwhelmed, out of control, and broken. Trauma affects how people view themselves, others, and the world around them. Another one is psychological trauma is an affliction of the powerless. The victim is rendered helpless by overwhelming force. Traumatic events overwhelm the ordinary systems of care that give people a sense of control, connection, and meaning. So one thing that we do focus on in therapy is what is called the window of tolerance. And so the window of tolerance is intense emotional arousal in the zone where intense emotions can be processed in a healthy way. So we want to be in that window of tolerance, and if we are outside of that window, that's when we have these 4 responses to fear. And this is where our body begins to become dysregulated and experience fight, or freeze responses or face. And having these responses are just ways to help keep us safe. But if we was wanting to go over each one of these, so fight is more of the responses we attack. Emotions, we might be angry, scared. The outcomes of this might be we're insulting, blaming, we have mistrust. And then the opposite of that is face. So here we're defending ourselves and confronting the fear. Emotions, we might feel connected. Outcomes, we're persevering and we keep on going. Flight is where we hide. This is where we can be in denial. This is where we avoid, we omit information. We might end up doing some self-sabotage. And then we have freeze, and I like to add another phrase to this is fawn, as in like a deer, where we like with a fawn is just we're freeze. Fawn is we're just complying. We don't have the option to fight or flight or face. We're just complying with what is going on. Here, we might be shutting down. And this is where we might be justifying our reactions and rationalizing why we might be responding this way. So these are the 4 responses to fear, and what we want to, our hope in therapy is we want to help children become open up or widen their window of tolerance so they don't become dysregulated and have these responses. But when does stress become traumatic? Because we can have a situation and where someone might experience it, but when does that situation become a trauma? So the first one is stress, and the stress is something that happens in a person's environment that is overwhelming, and the person believes will stretch their ability to cope in a healthy way. And then you're moving on to a crisis, where a situation that disrupts the status quo. This might leave the person feeling powerless and causes the individual to feel things might never be the same. And then the next one is the trauma, is when we experience that causes a person to feel overwhelmed, out of control, broken. Trauma affects how people view themselves, others, and the world around them. But what the last one is, we have allostatic load or chronic stress. And chronic stress is so allostasis that helps us adapt and survive in the face of stress, crisis, and trauma. So if we are experiencing that chronic stress, allostasis just helps us adapt to survive. So we can experience an allostatic load if we put too much pressure on the system, and then help to calm us down from ongoing stress. But allostatic stress can lead to significant health concerns. This is something that we don't constantly want to be in, that stressful situation. So what does stress look like, or what does trauma look like in children? And what are we looking for? Because it can look different for ages of kids, and it can look different for each kid. Each kid isn't going to have every single one of these, and this also isn't like they need to follow this list. Some of the things that they might experience might not be on this list. So for preschool age kids, we might look for feeling helpless and uncertain, fear of being separated from the parent or caregiver. You might see an increase in crying or a lot of screaming. You might see changes in appetite, where they're eating poorly or lose weight. This we also can receive regression, where they might return to bedwetting, might return to using baby talk. You might see them developing new fears. You might see an increase in nightmares. You also can see a lot of, they might recreate their trauma through play. That you also might notice them not developing to the next growth stage. You might see changes in behavior, and you might see them ask questions just about death. And then for elementary school kids, you might see them becoming more anxious and fearful, worrying about their own safety or other safety. You might see them becoming more clingy with a teacher or parent. They might feel guilt or shame. They might tell others about the traumatic event again and again. They might become upset if they get a small bump or bruise. They might have a hard time concentrating. They might experience numbness with emotions. They might have fears that the event will happen again. They might have difficulty sleeping. You might see changes in school performance, and you can see them become easily startled more so, and an increase in that hypervigilance. And then middle school and high school children, they might feeling depressed and alone. They might discuss the traumatic event in detail. They might develop eating disorders and self-harming behaviors such as cutting. They might start using alcohol or abusing alcohol or drugs, might become sexually active. They might feel like they're going crazy, feel different from everyone else. They might take too many risks, have sleep disturbances. They might want to avoid places that remind them of the event. Say they have no feelings about the event at all. And again, you might see changes in their behavior. And so these are just the different trauma models that we do work with here at HDC. And so the first one is the one that is the most commonly used is trauma-focused cognitive behavioral therapy, or commonly we call it TFCBT. So TFCBT helps children identify, address distorted or upsetting beliefs and helps them learn skills to help cope with them, to help cope with ordinary stress. It is a model practicum, so we follow a model and we do write what is called a trauma narrative to help the kids process the trauma and help with any distorted cognitions that they might have. Cognitive behavioral therapy in the school, or CBITS, is a program. It's a school-based program at the school. It uses CBT techniques, psychoeducation, relaxation, social problem solving, cognitive reconstructing, also uses some exposure. So this program addresses risk factors for developing chronic disturbances following trauma, including coping skills, cognitive factors, anything like that. It's a lot like TFCBT, but in a group form, in a group setting. And then we also use Bounce Back. Bounce Back is the same as CBITS. However, it is geared towards more of the elementary school kids. CBITS is more of middle school and high school. And then EMDR, eye movement desensitization reprocessing. So this is a focused approach therapy to treating trauma and other symptoms by reconnecting the person in a safe and measured ways to the images, thoughts, emotions, body sensations with the trauma that someone might have. And we're allowing the natural healing process of the brain to move toward just more adaptive resolutions. This last one I'm going to change up a little bit. Instead of parent-child interaction therapy, PCIT, I'm going to talk about CPP, child-parent psychotherapy. So this therapy is specifically for younger children from birth to 5 years old. This model, this is again trauma model for children who experienced at least one traumatic event. And so this model helps support caregivers in understanding how trauma impacts their child, developmentally, behaviors. It's more of an attachment focus, and the main goal is to support the caregiver and child relationship to help restore the child's sense of safety.
Okay, now we're transitioning to my segment. So some of the things we're going to talk about is how caregivers can support their children, extra support. And the first one would be, I'm ready for the next slide. One of the biggest things you can do is you can spend time with your child. And this would be time that, is fairly routine. And one of the things I do want to say is that even if this happens for a few minutes every day, it's definitely something predictable. It's oftentimes something like taking a walk together or baking together or reading together or even just getting down on the floor and playing together. Um, Everybody's family is a little bit different in what you like to do. So basically, it's that time where children can return to the security of their parents or their guardians or caregivers. And it's also something that oftentimes can be like a distraction for kiddos. So, during that time that you're spending with them, um, they might not be focusing on the trauma. Um, so definitely something to kind of get that dopamine flowing in their brains, which is the feel good response that we have. Now, a lot of times people get the dopamine surge, especially kids when they're doing their media or technology. Um, and that's kind of plays into why they get a little bit addicted to that stuff, but that's probably a completely different presentation. So my advice would be, time that you're actively spent doing together. um, and the next slide is another thing you can do is you can parent with patience and warmth. Now, anyone out there that has and is caring for a child that does have that trauma diagnosis, it can be honestly really difficult, because I think when the child that you're caring for does have that trauma and they're amped up, a normal response for a parent would be um, your stress goes right out the window and things like that. And you know, from time to time we lose our temper or we have our own emotional response, which sometimes causes us to maybe make hurried responses, or things like that. But one of the biggest things you can do is making sure to use those kind words. um, Also making sure that you praise your child when they're doing well or trying hard. um, Specifically, if it's an anxiety related event, even just a thumbs up for kids and between you and the kiddo, just kind of being like, hey, I know this is really hard for you, but I'm giving you a thumbs up because I want to acknowledge you that you right now are managing your stress. Or that your trauma response, and you're keeping it in check. So basically, if they're receiving therapy or they're receiving skills sessions, um, they're working their program, they're working their treatment plan. It's also great to let them know you're proud of them. And like I said, the doing the little thumbs up or whatever you have. I mean, we definitely all have our different interactions with our families, and also just trying to be patient when they make a mistake. But one of the most important things we can do is show them how to try again. A lot of times, there might be a step forward, there might be a step back, but we can always gather ourselves, use a coping skill, and you try again. And I think it's important that when you're helping your child and things like that, we're all human. We can't be 100% doing this at all times. And I don't think anyone at HDC or any practitioners you would with would expect you. But a really big example, for me is, modeling to kids that I'm human. I make mistakes. I also, really benefit on, if I'm making something that's a mistake, I own it. So I'm sorry, I felt stressed out. I kind of had a short response with you. That wasn't okay. Let me try that again. And just making sure that you kind of practice that. I think as time goes on, once they're doing like working with a therapist or a skills practitioner, ideally, trauma is present. However, um, definitely with care and therapy, some of the behaviors or some of the external signs you're seeing, and as well as the internal signs, you know, will decrease over time. Um, I can't really say how long that time frame would be for any given child or any given family. Why? Because we're all different. Um, and everybody has their own timeline on how they're processing things. I think as a child gets older and can fully express um, their emotions and their feelings, it's a lot easier to work with. When they're younger and all those developmental milestones are still kind of out there, and we haven't met those yet, you're going to see sometimes more acting out behaviors because they don't have words for it. So I can say hang in there, and know that if you're working with anyone from HDC, we're here to support that, and we're here to support you, and as well as your child. Next slide, please. Another thing that's a really big thing, and as COVID changes things, and just in life, one of the really important things for kids, especially kids with mental health diagnoses and trauma, is we got to have soothing and consistent routines. So basically, amidst, amidst chaos and change, maintain routines, and this helps reassure everything in life will be okay. Um, and so obviously you can't nail down every second of your day. Um, but some of the things you can do is some of your routines at mealtime and bedtime and getting up and ready for school. That's got to be pretty predictable. When we make it predictable and it's something that's repeated every day, that's really going to help kids get into that routine. And eventually, our hope is, I think all caregivers and guardians and parents feel this way, is that eventually kids are going to get into that routine themselves, and we're going to have to do less coaching over time. That is the idea. Obviously, as they're younger, they're going to need more directive and somebody being there. But as they get older or become more able to control their calming skills and their coping skills and stuff, you can find that, you know, you can take more of a coaching role. And of course, that's really it's gonna be depend on whether they're um, experiencing in a time where they have more symptoms and things like that. But always continue those special routines, whether, it's prayer or singing or just that one-on-one time. And I definitely understand that some there's we all have different work schedules and different jobs, and sometimes there's more than one child, and um, foster parents or guardians might be dealing with a situation where they have multiple children and they're all a little bit different and their trauma exposure is different, and they have very different behaviors. So keeping that in mind, I always find, and that has been easier for me is sometimes, during the time when you're distracted or, have multiple things going on, you're trying to wear many hats at the same time, the cooking, cleaning, you know, managing behaviors, things like that. I've always found that, and I learned my lesson early on, as a practitioner and a provider is I do try to say if they catch me when I'm distracted, I try to say no. And because I know that saying no, that no can always turn into a yes. But sometimes when you say yes, and kiddos are often really good at catching you when you're distracted. It's hard to backpedal with that, yes. But I do know it's easier said than done. But I know as a young practitioner and CTSS worker, oftentimes I would say yes, and then I couldn't make it happen. And boy, did I spend a lot of time backpedaling. And the next slide is basically it's the small things. So all these things might seem like really small things, and they might also be things that you already do. But giving that extra support and time keeps your child feeling loved and close to you. And after a trauma or closeness matters more than ever. Just keep that in mind. Um, Next slide, please. Another thing we need to do is just like us as people, we're all different. We all have different behaviors and reactions to things. Like I said, children are going to be coping in different ways. There are some kids that need extra time with friends, relatives, family, while other kids might just need that time alone. Um, Obviously, we don't want them isolating too much and not interacting in the world that is their family or their school. But one of the things we can talk about with kiddos is that, you know, eventually you're going to be able to learn to express that I need some time alone. And obviously, as a parent, depending on the level of supervision they need, or also just kind of your kid, and obviously the children you care for and stuff, more often than not, you're going to know them better than anyone. And so you can judge whether that time alone is giving them a few minutes to collect their thoughts and then check in with you again, or whether they're isolating and avoiding. Because we don't want that to happen. But sometimes some people need more time to process their feelings. And as long as you're teaching the kiddo to respectfully, ask for that time, it can be more than reasonable for you to give that time, but it's also reasonable for you to put expectations on that and just say, hey, all right, I'm going to give you 15 minutes, and in 15 minutes, I'm going to check in. Maybe we'll make a plan to talk right away, or maybe we're going to talk about it in 2 hours, and you'll just kind of go for there. But you also want to make sure you know where they're thinking and checking in with them regarding whether they're using coping skills that are healthy. Um, and, for that, you can definitely hold them accountable. I think the more you practice people to use positive coping skills um, instead of negative ones or ones that are hurtful, um, the more practice we have, the better. And if it starts in childhood, that's awesome, because then you're arming your child with tools that can last a lifetime. I mean, they might change, but they'll be able to find things that work for them. Also, it's completely okay for you to let them know that you're experiencing feelings as well. And your feelings can be guilt, anger, and sadness. And one of the big things I always say, I feel, and that's a huge statement that we like to say a lot, because then we're not saying you make me feel this way, and sometimes that does come out, but we don't mean it. Usually you try to label your feelings, and the more more you do that, the more kiddos are apt to do that themselves and labeling their feelings. And I think building their emotional vocabulary is very important, and kind of identifying that. But you can let them know that you're experiencing feelings too, because you're a person. Um, Obviously, as they get a little bit older, you probably want to gauge yourself a little different, because sometimes in those teen years they can turn the tables on you real quick. But um I always say that your emotions that you have are completely valid. All of our emotions that we have, they're valid, they're okay. um, but sometimes the behaviors and the way we choose to act on those feelings aren't okay. And they're not positive, nor are they helpful. So that means if that comes for the kiddos, we have aggression or things like that, or property destruction, or just being rude in general. Those are things that are not positive choices, and it's not helpful to them or to anyone else to solve the problem. Another thing is that everybody expresses those emotions differently, and you're going to see them externally differently on a lot of people. I'm a huge one that I might not cry when I'm sad, um, but that doesn't mean I'm not feeling sad. And another thing, is sometimes we cry when we're just really mad. So just encouraging kiddos to label those emotions, whether have a feelings chart that you post on the wall and they point to pictures. There's a lot of great stuff online. Or as they get older, you've got a list of words and they're picking the word and they're using it, and we're kind of making sure they understand whether they're using it appropriate. But we're all a little bit different. So um, sometimes what is sad um, might not come out the same way in everybody. Next slide, please. Um, so a lot of things we talk about, especially if you have experience with meeting for outpatient therapy, or if you're already involved in CTSS, is we talk a lot about coping skills. And I think a lot of times when I meet kids, they're like, oh my God, coping skills. And I even will have some kids go, oh, you're not going to put deep breathing on there, because I don't do that. One of the things is that ideally we might make that a goal, so and so practice 5 deep breathing skills. But we also know as practitioners that if the kid is not wanting to do that, then we're going to open it up and we're going to explore all the different things that we can do and find what tool works for a child to use it. And usually maybe they'll start with one coping skill at a time, and then they'll increase it as they get more used to practicing it, which they do in skill sessions. The more often they're practicing those skills, really increases the chance that the child will actually use that coping skill when they're in the moment, whether it's a big moment, the heat of the moment, I like to say. So whether that moment is friend or anger or things like that, but it does taking practicing, and it does take reminders to say, hey, I think do you need to use a coping skill? I'm seeing that you're kicking your brother and you're throwing stuff. I think that you need to use a coping skill right now. Um, and some of those could be encouraging physical activity. I know definitely when they're younger, I mean, I don't think any caregiver parents will agree if they don't exercise and get some time to kind of exert that the energy they have and stuff like that. Number one, physical activity is a distraction skill. Another thing that happens when people are physically active is that you're going to have an increase in serotonin, which is another one of those hormones that Serotonin is a good thing. It makes, more serotonin you have, especially if have another, diagnosis of depression or stuff, we're a little low on that serotonin. So if you can get that pumping, that's a good thing. And sometimes that means, depending on their level and what they're interested in, sometimes that means exercising with your child, taking those family hikes, or finding what you can do. And what I always say is, you know, actively engage in it, be outside or inside. But if you have to be creative and find something, if we're trying to quarantine and stuff like that, there's a lot of different ideas. Make it your own and make it happen. I've had families before that during the pandemic, or, during certain times, they had 5 minutes every day where everyone was as loud as they wanted to be for a few minutes. It's just really being creative and kind of owning it and making it your own, like I said before. Again, find out what you can do and do it, whether that's groups, sports, mentorship programs. Make it happen. Obviously, depending on whether or not, you are choosing to be part of the community right now, or if you're trying to kind of keep a safe distance to keep the family healthy, that's obviously your choice, and you're going to make the decision that's best for you. But really trying to find those creative spaces indoors and keep things interesting. I know as a CTSS provider, I spent well over a year doing the majority of my sessions, well, actually all of my sessions, through telehealth. And I mean, it got to the point where, I was finding like digital escape rooms online where kids had to solve mysteries and stuff. So sometimes it's a lot. Another thing that really works nicely is participating in co-regulating coping skills. And what that means is that you are actively participating in that skill with the child, whether it's reading a book or coloring, taking those deep breaths, or just sharing a deep squeeze hug. Um, Obviously, that doesn't happen as often as they get older, and they do get to the point where they're kind of like, I don't want you to hug me. But there's little things you can find. And yeah, I mean, you can really be creative. If you type in scoping skills on Google, tons of stuff come up. If you click images, tons of picture charts come up. If you click video, there's videos all over the place. So keeping that in mind. And the next slide. Some of the things is there are specific coping skills that are for trauma. And sometimes they call it a coping skills box, or what you can call a toolbox of deep breathing, relaxation skills, and meditation skills. This is one thing that I've worked here at HDC, and I know Amber Wing is big on the coping skills boxes. But even when I worked in a day treatment program and I had kids aged, I mean, anywhere from 2 to 6 years old, sometimes they'd make their own box. And in that box, I was pretty creative. I'd have breathing exercises. I would have, picture charts of different relaxation skills you can try. I'd have fidgets. I'd have a book. I had like just some crayons and a piece of paper. From time to time, I had little kiddos that one thing they really liked was, and helped them kind of distract themselves, is they even liked, just taking a piece of paper and tearing it up into little bits. So obviously, we're trying to find something that works for the kiddo that they're willing to practice. And as I said before, they're not always a huge fan of that deep breathing. Sometimes in session, they we're just going to have them try. Because I know I personally am like, deep breathing doesn't do anything, but I know the times that I've like focused and tried to kind of really be mindful in what I was doing. I mean, I have to admit it helps. Um, Another thing you can do is re-engage in a hobby or activity that you haven't done a while. Um, there's lots of things that you can do, whether it's crafting. I know a lot of kids that don't necessarily want to practice skills, um, but if I give them, a blank canvas and some paint and say, paint this emotion, um, they seem to enjoy that. Of course, we all know everybody's a little bit different, and some people are more artistic. Some people find more pleasure in doing things. Um, so it's just kind of a matter of finding that and also knowing that their coping skills could change over time. We just want that toolbox to really be something that has a lot of options in there for them. And, a lot of times, just by taking a shoebox and letting them decorate and just putting little things in there from the dollar store or that you have around the house, a lot of times if they can take ownership about what's in the box and what they can choose, works really nicely because number one, you're giving them a little bit of power. You're giving them some choice in what they want to do. And a lot of times kiddos really like that. But also, if you're giving them a choice on what's in that box and what's a safe coping skill, is you're also kind of getting what you need too. So kids are practicing skills, choosing what they want, and you've got them looking at the box, doing something is healthy and safe for them and is a good outlet. Um, Finally, one thing that is great is having the kiddos make a list of people that they trust and um, you can call when you're not doing well. And this is for you and for the kids. Um, so if kids can know in different scenarios, like who can I talk to when I go to school? I mean, some kids will say, I want to talk to my teacher. Other kids really know who their guidance counselor or their principal is. And, making sure you have a couple options because, obviously teachers and educators, they can be busy too and have more kids than once, but knowing I worked with a lot of kiddos at Barnum Elementary School, and they had a TLC room, like where they could take a break. Some of them would talk to teacher about their problems. Some would talk to me. Um, Others would say, I need to go see my guidance counselor, and they would go there. So just making sure, and also making sure that, they make a list of those safe people that they can talk to and that they'll follow through with doing that, and obviously that might be something they can work on in skills and therapy is being assertive and advocating for themselves. Also, for you, the parent, the guardian, the foster parent, the caregiver, whatever terminology you have, is you need a list of people you can trust and that you can talk to when you're not doing well. And sometimes that might just be a 2-minute phone call with a good friend or a family member. One of the biggest things I will say is my mom is great. But even though I'm older now, my mom, one of the things she does if I just want to vent to her, um, sometimes she'll go right into problem solving mode. And sometimes she gets frustrated with me and she'll say stuff like, well, I don't know what you want me to do for you. And I've kind of learned, and unfortunately, I learned this a lot later in life and put into practice a lot later in life than I wanted to, is telling or saying to the person you're talking to is, I don't want you to solve my problem, but I do want you to listen about my problem. Um, so make sure you have supports that you can talk to. And it's okay to set boundaries with people regarding that. Whether it's just saying, I just need to vent for a minute, boom. Okay, I'm good. All right, I'm going back into the fray. Is something that's very useful. But making sure you have these supports or people you can talk to. Let's see where. Okay, next slide. The next one is we're not going to discourage emotions. We are going to acknowledge them. So, like I had said before, one thing we want to do is we want to remember that emotions are valid. And, if a kid's using the wrong emotion, we can always use that opportunity to teach them. Behaviors aren't always safe or positive. Um, so we want to keep that in mind. But even saying little things, and some of these are really automatic responses, is instead of saying like, don't be worried, you might can say, yes, I can see that you're worried. Another thing is there's nothing to be afraid of. Another way you could say that is it's normal to feel scared right now. I'm even one that, well, I remember, when I felt this way and I was really scared, and just acknowledging that you've experienced these emotions before. I am going to put it out there that it can be very frustrating at times when, you know, that if they're in a safe environment with you and you're there for them, they really don't have anything to be afraid of. But once again, that's where the emotion they're feeling, it's valid. One thing I don't, want people to say is if you're doing everything that makes that child feel safe and, setting up that safe environment and stuff, their emotions are still there and they're still going to be afraid. It doesn't always mean that it's what you're doing. Um, Sometimes fear just creeps up on people and it's overpowering. Um, so keep that in mind. And I would say, really treat yourself with grace because there's only, so much you can do. And sometimes you feel like maybe it's not enough. I really don't want anybody beating themselves up about it. All you can do is continue to be there and be supportive and move from there. And the next slide is acknowledgement. And basically it's not okay. It's okay if you don't have all the answers. It's okay if you say, I don't know. It's okay if you say, might need a little bit time to think of the answer to this or to find it out. I'm gonna write this down for your next therapy session, but I do want you to know I'm here for you. Um, and that's just by listening and accepting their feelings. And sometimes it's really, really difficult not to have your own emotional response or to kind of have an answer. But sometimes it's okay to just have a pause and be supportive. I can tell you that hopefully eventually you'll see a reduction in symptoms, and the timeline isn't always there. Next slide is, I think, some of the signs of recovery that you're going to be seeing is, you might see an increased sense of playfulness. A kid might have a return to thinking about the present and the future. A lot of times, when trauma is involved, you're just kind of in that chronic state of what Taryn was talking about earlier, like you're frozen in time. When you hear kids talking a little bit more about the present and the future and talking about looking forward to things, that really means that um, they're starting to not be kind of stuck or in pause in that moment of a trauma, but their mind is allowing them to go elsewhere. Another thing you'll see is increased sleep and appetite. Um, you'll see a little bit more yawning. Sometimes folks that are in trauma, they don't sleep very well, or if at all. And you'll see a little bit more of an appetite. You'll also see some more crying and reaching out for comfort. And that's a normal response when a child reaches out for comfort. It's kind of like that circle of security, right? So if they're coming over and just giving you a quick hug and then buzzing back to whatever they're doing, that's fine. Crying might increase for kiddos that I kind of mentioned before, that they're sad but they don't cry. But maybe or maybe they're more comfortable crying and they're actually letting themselves totally feel the feeling. Um, and kids are wanting to memorialize rather than ruminate. So they're able to kind of, look outside of that trauma and, as best as they can, day by day, minute by minute, are willing to move on. Ruminate maybe sounds a little bit of a negative word, but sometimes when we ruminate, we're just stuck in something, and we can't see anything beyond it. And we're not wanting to hear, any help or anything. Another thing is you'll see some more self-acceptance and increase in expressing their needs and emotions. And I really think that's great. And a good sign in kiddos, but regardless of what emotion they have, that doesn't ever give them a Visa card to be aggressive or to be rude or mean. And another thing, you'll just see kind of a relaxation in that muscle tone and even their vocal tone. And just one thing to consider, what are some indicators you notice in yourself and your child? Like I said, all of you can probably look at the kiddo even from across a very crowded room and see them and kind of know what you're thinking. But just kind of just really, being present in that time and just saying, oh, okay, I'm seeing his shoulders go down. I'm seeing a smile. I'm seeing he's not constantly turning around looking for me. Um, maybe he looked for me constantly, but now he's taking a 5-minute break in between or a half hour or however it works. So those are some signs of recovery, and obviously further signs of recovery and stuff, you would defer to the clinician, and they can provide more insight and things into that. But once again, we're all different, so it's going to look a little bit different in all of us. And now we're going to move on to just a little case study that we have, and just kind of do a model of what we might see from a kiddo. This one's a little bit about COVID. So I'm going to hand it off to Taryn.
All right. So Jane is 11-year-old female body person. Jane lost her grandmother to cancer. Since the onset of COVID-19 pandemic, Jane has been exhibiting symptoms such as washing her hands frequently, compulsively using hand sanitizer, fear of touching often touched surfaces, fear of getting sick or a family member getting sick, and protesting when asked to leave her home. Jane reports having nightmares once a month about herself or a family member dying from COVID-19. When Jane watches the news, Jane's mother notices she becomes agitated and remembers detailed information from the news days later. Jane has been distracted during distance learning and struggles to retain new information. All right, so what can we do to help support Jane? And again, this isn't an all-inclusive list. This is just some examples of how we can help support Jane. So one thing we can do is check in with Jane daily and validate her expressed feelings. We could offer her a hug. In this case, we might want to limit Jane's news exposure. We wouldn't necessarily have to, you wouldn't have to limit news exposure with your own kids, but just being mindful of the news and what the kids are watching, especially in Jane's situation. Just be mindful of what she is listening to. Maintaining a consistent routine and plan for fun activities. Practice coping skills with Jane to help her tolerate anxiety. Again, that's it. We want to increase the window of tolerance. Ask if Jane is okay with discussing additional support school can offer her to increase academic success. And then how else can we help support Jane? Like I said, this isn't an all-inclusive list, but any other ideas of how someone might be able to support Jane?
And if you want to, you can throw it right in the chat.
Yes.
But no pressure to do so. And we can give everybody just a couple minutes or like just a few seconds. If you got a question, pop it out. If you don't have your question immediately, feel free to move back. But one of the times right now, if you can maybe share something that would be supportive for Jane, this is also a time, if anybody has any questions out there, feel free to ask those questions. If we're not really seeing a lot of responses, we're certainly not gonna awkwardly pause for several minutes. But if there's anything you have, Joni can make sure that we see your thoughts and we are able to answer your questions to the best of our ability.
Thank you, Taryn and Marcia. We might wait just a few minutes to see if people want to chime in. Well, I'm not really seeing any questions. Well, Marcia and Taryn, do you guys have anything more to add, or should we we might wrap up a little early, but give people some time to stick around if they wanted to ask more questions?
And
What do you guys think?
yeah, and just a reminder, questions you ask are only go to the host and to Taryn and myself, and your name certainly will not be advertised to anyone. Other than that, our family support series is starting up again. We took the month of December off. One of the things I want to share is our next presentation, and it'll always be, I believe, that second Tuesday of the month. Correct me if I'm wrong, anyone. And the next one is the effects of peer pressure on children, adolescent and parental substance use. I am also pleased to announce we are adding an additional pandemic, or not pandemic, session in March. It's kind of an interesting one. If you're familiar with the Cold K area or Carlton, they have the REACH program here. Once on a quarterly basis, I meet for the local advisory council with the director of the child mental health unit over at the county, Brenda Carlson, and some of the family school support workers. And we also have people from the Reach join us. And some of those people are kiddos that have permission or consent. And I was in one of these local advisory councils, back in the September, and some of the young people that were there when I was sharing about this event, one of the things they said to me is they're like, can you do one of these that's student led? And a working title we have is how to talk to your kids about their mental health. And I checked in with everybody at HDC, and they said, let's add the session. So if you have any kiddos in the Reach, you might be seeing a waiver soon. That waiver is, it's okay for them to work with me. And also, if they so choose, they can be part of that Zoom presentation. And we're going to see where it takes them. And I've met with them once already, and there was a group of about 25 kiddos, and they were very passionate about it. And obviously, I'm challenging them to, they can share their responses with caregivers and how they feel, but they also have to practice what they preach and make sure that their interactions are respectful and, take ownership for behaviors they might have. So, more information will be coming out about that one that we're adding. Feel free to attend, and I guess thanks everybody.
Yes, thank you so much for joining us. And if you have any questions, I'm glad to stick around for any questions.
Thanks, Marcia, for sharing that with us. We got a thank you in the chat. You're welcome. Oh, thanks all.